Now that I've given you a little bit of background, I want to turn things over to the panel. We're going to start with Jay Kaminski, who is a physician here in Hampton in private practice, and is also the founder of the free clinic at the beach. So Jay, let me turn things over to you. How does the lack of insurance affect, from your perspective, cost and access to care? And by Jay's perspective, he's speaking not only for himself, but on behalf of the physician community.
I didn't have anything prepared tonight, but if I had anything to say, it would have been exactly what Wendy said. Those statistics are well known in the medical community. And it's true that here in Hampton, down on the beach, at the clinic, the vast majority of people we see are uninsured people. They cannot afford any of the services otherwise. Even the cost of medicines can be very difficult when you're getting minimum wage, doing a job at Burger King or wherever you happen to be working. It's extraordinarily difficult for them. One thing that Wendy didn't mention about more well-to-do people who are uninsured, they actually pay a burden too. Those people end up paying usually 100% of whatever the cost is for whatever medical care they have. So those people who are uninsured but have a little bit of money really get knocked, because people with insurance pay somewhat of a discount. They will pay 80% of their drug costs, for example, oftentimes through their plans, or sometimes even much less than that. But people who are making enough money to have some insurance but can't afford that insurance otherwise because of children or other circumstances really get pounded terribly in the healthcare market. We're going to see this worsen not only from the point of view of the cost of healthcare and the number of people because of the recession who are becoming unemployed, but we're going to see this worsen because nobody's going into primary care, because primary care physicians don't get paid like other physicians. An orthopedic surgeon on average gets 5 to 7 times more than a primary care physician gets paid per year for doing what the orthopedic surgeon does. So the access to primary care and preventive services is going to take a very significant hit over the next few years. The number of residencies in primary care have actually decreased in the last few years because they can't fill them. Even with foreign medical graduates, there simply aren't enough people interested in getting into primary care to do the job. So you're going to see fewer and fewer primary care physicians. You'll see more and more primary care clinicians. You'll see nurse practitioners and physician's assistants hopefully filling the void, but their training is very different. The way they approach care is very different. Physicians are still required, from many points of view, to override the system and understand and help people negotiate the system. Nurse practitioners can practice independently, I think in the state of Maine. I don't know if they can in the state of New Hampshire or not, but basically that's a very significant rarity even in Maine. So the access to primary care is going to take another significant hit. One thing we're able to do at the clinic that we can't do so easily in the office is preventive medicine, because preventive medicine doesn't get reimbursed. For those of you who have insurance, if you're a smoker, you can't go to your doctor for a smoking visit because your insurance won't cover that. Down in the clinic, we can take all the time in the world we need to help people quit smoking. But if you need a dietitian, you could be in trouble with your health insurance plan. So we have the ability to do things down there, fortunately, from a preventive point of view. It's very critically important, because if you can work with prevention, a lot of the other things that are required are absolutely unnecessary. The people over 65, I'm sorry, I don't know if I saw that there. People over 65 consume, depending on the statistics you look at, somewhere between 30 and 50% of all of the health care that's consumed in this country. And if you can work ahead of time to prevent some of the chronic diseases that nag people, hypertension, diabetes, coronary artery disease, if you can work on people early on with diet, smoking cessation, substance abuse prevention, then you go a long way towards reducing the costs in the long run when people ultimately get to the age where they need those services.